So in talking about medical conditions that are related to the bile duct and the pancreas, one of the methods that can be used in diagnosing them and also treating them is what is known as a what? Coming? Is what is known as the endoscopy retrograde cholangiopancreatography. Okay? Endoscopic retrograde cholangiopancreatography. So it's actually a method that can be used to diagnose if there's any problem in the bile duct or if there's any problem in the pancreatic ducts. Okay? So you can use to diagnose and also to treat. Okay? So it's both diagnostic and what? Therapeutic. Okay? So this is the endoscopic retrograde cholangiopancreatography. So in here we're just trying to define it. After we define it, we look at the indications. That's basically when to use it. Alright? You look at the procedures, you look at the therapeutic interventions, they look at the risks and complications, they look at the post-procedure care. Like after the procedure, then like how to monitor the patient. Okay? So for the definition, you could say you're using an endoscope, you put it right here to come and operate around what? The bile duct or the pancreas. Okay? So the endoscopic retrograde cholangiopancreatography is a medical procedure that combines what? Endoscopic and fluoroscopy. Okay? And you are doing this to diagnose and treat any conditions that are related to bile duct and pancreatic duct. Okay? So here's a detailed overview on what we'll be talking about this endoscopic retrograde cholangiopancreatography. For in the indications now, when to use it. If the patient has jaundice, you might be opting for this. The patient has abdominal pain, you might want to go look out why. Okay, why the abdominal pain and all that. Then there's a weight loss, there's suspected bile duct. You suspected that there's a bile duct or pancreatic obstruction. Okay, then if there's presence of gallstones, if there's inflammation of the pancreas. Okay, then if there's a biliary or pancreatic cancer, you might also want to opt in for this. Okay, so this is what endoscopic retrograde what cholangiopancreatography. Now talking about the procedure, patient's preparation. If you want to do this, of course the patient will not eat for some time, so the patient will fast. Okay, sedation and antibiotics if necessary. Okay, then endoscopic insertion. Sedation is basically like you give anesthesia, make the patient sleep off. Okay, the endoscopic insertion is through the mouth into the duodenum. Alright, cannulation now, that's insertion of the catheter into the bile or pancreatic duct. Okay, then contrast injection. You are adding a contrast just so you could have a clearer view of everything. Okay, so you give them contrast just to visualize the duct on the fluoroscopy. Okay, the imaging, you could use x-rays or fluoroscopy just to guide the procedure. Intervention, removal, that's like the last one now. That's when you're finally there. So you're trying to remove what? Stones, or you want to place a stent, or you want to do what? Collect some tissues for biopsy. That's tissue sampling. Alright, then therapeutic interventions. Now you want to do like sphincterotomy. That's cutting the sphincter muscles to facilitate stone removal. Then stone removal, that's using balloons or baskets. Alright, stent placement, just to relieve obstruction or facilitate drainage. Alright, biopsy, you want to take out some tissues to send to the lab to actually know the condition. Alright, so you take out some tissues for what? Histopathology. Alright, so talking about the risks and complications, this surgery, you could say endoscopic what? Retrograde cholangiopancreatography. This is your endoscope. So you are bringing it right here just to do an operation and all the stuff, right? So it could lead to inflammation of the pancreas, as pancreatitis. You could affect some blood vessels, so that's what? Bleeding. Okay, could lead to infection. It could lead to perforation. it could lead to the person can react to the contrast or sedation. Okay, so post procedure care, that's after you've done the procedure and all the stuff, you might want to start doing some care. So you might want to just calm down, monitor the patient for possible complications. All right, you do some pain management, you give antibiotics if you suspect that there is a bacterial infection or there would be a bacterial infection. All right, then you could do some follow-up appointments with the patients just to actually check them out, like what's up, how you doing, and all the stuff. Right, so that's it about the endoscopic retrograde cholangiopancreatography. Definition, indications, procedure, risks, complications, and everything. Okay, so that's it. Bye for now.